ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरः गुरु साक्षात् परब्रह्म तस्मै श्री गुरवे नमः. With due respect to our Hatyogi Nikam Guruji and all my colleagues, last 1 or 2 months I am coming here and every time I am giving some part of the yoga lecture which is helpful for the healthy lifestyle. Now what is total health? Total health is a health which is at the level of physical, mental, social and spiritual. As a surgeon, as a doctor, we can give only physical health, but mental, social and spiritual, I cannot give it to you. So you have to achieve it on your own. Now why this is coming, why the problems are coming, why you have to look after the total health? Because of the modernization, civilization, pollution, then fast life, fast food, all these things are making life miserable. We think that because of all these things our life has become very advanced, progressed, but at the end of the day we realize that it is miserable. The style presently is a very fast life. You have to catch a 7 train to go to the office, so you are in hurry. Then fast food, I always tell this, again today I will repeat it. In olden days, what was the proverb? कम खाओ, खूब चबाओ, यही है तंदुरुस्ती का खजाना. लेकिन आजकल क्या हो गया है, प्रॉवर्ब मॉडिफाई कर दी गई है. खूब खाओ, कम चबाओ, यही है फास्ट फूड का ज़माना. And that is why the problems are occurring. So many times it comes into the paper that this food, junk food, all these McDonald's, all the fast foods, they are not good for the health. If you keep on eating this food every day, you are likely to get high blood pressure, high serum cholesterol, heart problem. When Dr. Abdul Kalam was president, that time DRDO, which he was heading, they have published a report that if you eat daily this junk food, you are likely to get these diseases. It comes in paper off and on. But we are not reading that. We are only reading other things which are useless. Then excessive mental tension, mechanical mind. Then mad race. If somebody neighbor has got a Maruti 800, I would like to have something better version, so I want Honda City. If he is having Honda City, I want Altis or then Audi or something of that sort. And to get that, we try to earn more. And how you can earn more? You have to work more. And in this race, you forget about your own health. And when you achieve everything, when you get to your bungalow, you have got a good car, you have got a nice bungalow, all bank balance, then FDs and lot of shares. When you say, now yes, I got everything, that time you realize that you cannot enjoy any of these things. Because by that time you already got blood pressure, you already got diabetes, so you cannot eat good food, sweet. Because you have got heart attack, you cannot go for trekking, you cannot enjoy the trip. So what is the fun? Why to earn all these things if you cannot enjoy it? So don't run after this. Have some satisfactory level, ki bas it is enough for me. So that will help you. Now this mental stress, I also conduct camps under the banner of Indian Cancer Society. I go at different places, corporate places, social places, private places. I found that in corporate places, the boys at the age of 25, 30, 35, they were having high blood pressure, they were having diabetes. Why? Because they are working in corporate sector, they have got a target. They have to achieve this much thing in this time only. If they cannot, they are sacked. So there is always a tension on his head. And that is why all these young boys, they are suffering from diabetes, blood pressure. Can we treat mental stress with medicine? If there is a stress, patient goes to psychiatrist, he gives medicine. Patient takes those medicine and goes to sleep. When the effect is over, he again starts thinking what is happening. But mental stress can be treated by yoga. And that is why the importance of yoga. I always tell this, as a modern allopathy person, what we have done, we have divided the human being in multiple pieces and each piece is treated by a separate specialist without knowing what is happening with the other piece. And that is why the problems are occurring. But yoga has got a holistic approach. If you practice all these kriyas, all organs of your body, all systems of your body, they will work properly and you will not get any disease. I always tell, our yoga has become foreign written. It was yoga, now it has become yoga. The A of America got attached to it, and so it has become yoga. Western people, they are following it very religiously. I had gone 2 years, 3 years back. I have seen that in each Newcomb corner there was a yoga institute, there was a yoga center. So much importance they are giving. If you have heard the name of Dr. Dean Ornish, who is a famous cardiologist from US, he treats heart attack patient with the help of yoga. He is treating with the yoga. But if we say in India, yoga is the best, you say, what you are talking, we have gone to moon and Mars and this, and we have so much forward people, improvised people, and you are talking about ancient old thing of yoga. Nonsense. But they understood the importance. That's why Dr. Larry Dossey, who is a cardiologist, a writer of a big book, he said, yoga is India's gift to the world, and for which entire body of humanity should be grateful. Our human body, if you compare with the machine, it is like a heart and lung, they are like a non-stop pumping set. Eyes like a camera and projector. Ears like sound box. Stomach is like chemical laboratory. Nerves are like miles of communicating system. And mind is an unparalleled computer with infinite capacity. हमारे पास संगणक महासंगणक आ गया है, उससे भी बड़ा संगणक ये है. It cannot compete with any of the man-made computer. And the greatest thing is unbelievable coordination amongst all of them. And yoga tries to maintain it. Now, somebody might still think that yoga is a mystic. But I say it is a science. When sages have written book, they were knowing the importance of yoga, and they know all these things. And how it is correlated, I will just show you. You must have seen this picture about the chakras, these different chakras. Are they imaginary? When sages have written book, they said that here is Ajna Chakra, here is Vishuddha Chakra. They have written, I have read and I am telling you. Is it imaginary? Or whether sages have come in our hospital, they said, doctor, you take rest today, I will operate today and I will see where are the chakras, because I want to see. What is the truth? They are not imaginary, they are there in our body. We have seen them, we will just see it and correlate. This is the Muladhara Chakra. Which is situated near the anal opening. It is called pelvic flexus from medical point of view. This is the medical depiction. When we saw it like this, and this is the yogic depiction. There are 4 petals. Then Swadhisthana Chakra, it is near pubic symphysis. This is the Swadhisthana Chakra. This is called aortic flexus. This is medical depiction, and this is the yogic depiction. There are 6 petals. Manipur Chakra, this is called solar plexus, which is near at the umbilicus. This is the medical depiction, and this is the yogic depiction. There are 10 petals. Anahat Chakra, which is at the center of the chest, it is called cardiac plexus. This is medical depiction, and this is the yogic depiction. There are 12 petals. Vishuddha Chakra at the neck, it is called cervical plexus from medical point of view. This is yogic depiction. Yogic depiction is not shown here. Medical depiction is not shown here, and yogic depiction is like this. There are 16 petals. Here at the center of the forehead, it is Ajna Chakra. It is called optic thalamus or optic chiasma. This is medical depiction, and this is the yogic depiction, and there are 2 petals. Now, why I told you remember 4 petals, 6 petals, 12 petals, 16 petals? Because they correspond to the branches from medical point of view. The simple example here itself you can see, here are there only 2 branches and there are 2 petals. Similarly, other chakras, when there are 10 petals, there are 10 branches of that plexus. So sages were knowing all these things, and they are not imagining and telling you something like
the eyes at the top, eyes.
Yeah. So this is the vertebral body, vertebral column, backbone. On the side of the backbone, this is the chain of the chakras. From here different nerves come out and they supply to the different part of the body. What are they? This is the eye, this is saliva secreting gland, lungs, heart, stomach, liver, spleen, pancreas, small intestine, large intestine, kidneys, and anal opening. All these organs, they are controlled by the chakras through these nerves. Now somebody might say that yesterday I had gone for some party, so I had little excess dinner. So today morning I skipped my breakfast. I had little in the lunch and I might not take anything in the dinner. Why? Because the stomach is upset. Where is the problem? Problem is here. Somebody has got heart attack. Where is the problem? Problem is here. Somebody has got asthma. He has to use pump. Where is the problem? Problem is here. Somebody has got kidney problem. He has to undergo dialysis twice a week. Where is the problem? Problem is here. Means if any one of these organ is not functioning properly, you are called sick. If all these organs are functioning properly, you are healthy. Now when they will function properly? When the control is proper. When control is proper? When all these chakras are functioning properly. To activate these chakras and to make them function properly, we do Omkar. How we do? We breathe out, then breathe in. When you practice Omkar on your own, you will find, you will realize that these vibrations, they go on activating all the chakras, they function properly, the control is proper, all organs are functioning properly and you are healthy. In Western countries, they have done research on Omkar and they have shown that if you do Omkar every day, all your organs will function properly and you will not get any illness. So this is the importance of the yoga. Then today's chapter, today we are going to take only two kriyas, that is Agnisar and Udyan and Shankha Prakshalan. Now before going to the kriyas, we will just see the anatomy which is related with that part. It is related with the gastrointestinal tract or digestive system, which starts from here. This is oral cavity, this is the esophagus, this is liver, stomach, pancreas, small intestine, and this is the large intestine. Now when you take your food, lunch, dinner, breakfast, anything, it comes into the stomach, it stays there for 2.5 hours, it gets digested and then it goes ahead. In a patient of acidity, after lunch or dinner, 2.5 hours after lunch, what remains here? Excess acid. When this acid goes up over here, you get burning sensation over here. And if it crosses this line, because on this side is acidic medium, on this side is alkaline medium. When this acid crosses and comes to this side, it causes corrosive action and you get ulcer. So if you want to avoid this, you should have minimum acid and it should not go to this or that side. And what we do for that, we will see in the next slide. This is the inner lining of the stomach. This is so delicate, so delicate. When we are operating, by chance suppose we scratch with our nail, it starts bleeding. It is such a delicate thing. So if there is excess acid in your stomach, what is the function of stomach? It digests the food. So it acts upon food. Now suppose whatever you have taken, it has passed ahead. Now excess acid remains here. What it will do? It will act on this mucosa and you get severe gastritis or ulcer. So to avoid that, we should have minimum acid in the stomach. Then only you can avoid acidity and ulcer. Now this is the pancreas, just behind the stomach. It secretes insulin. Insulin controls blood sugar level, so you don't get any diabetes. Now this is the small intestine, about 23 feet of small intestine. Means if you start from here, you can go up to there. And this is the large intestine. The connection between this to the small intestine, this is called mesentery or parda. When you get obesity, you get lot of fat deposition into this and then the problems starts. Now coming to the Agnisar and Udyan, just pause correct minute. Now this we have to do at empty stomach. What you have to do? You have to breathe out totally, then stand like this and then make movements of the tummy like this. Kapalbhati is with breathe. This is without breathe. I have totally exhaled out. First I have breathed in, then I have totally breathed out. Then in this condition, Then I am doing like this and then making movements of the abdomen. When I feel that I cannot stay without breathe, then I will relax the abdomen and then breathe in.
This can be done at any time or on empty stomach?
Empty stomach. So this is called Agnisar. Now when it is to be done? It is to be done in the morning, usually, because when you take your dinner in the night 10 o'clock, slowly it gets digested, and after 2 a.m. it is totally empty stomach. So morning you brush, then go to the toilet, and then if you do this Agnisar, you can get good results. Now how many times you will do? In a set, in one breathless without breath, you can do maximum 30-40 depending upon your capacity. Now I can do at least 30-33 in one set, one stroke. I do 3 strokes like this, so about 90 I do. Our Guruji used to say, if you do it for 100 times, you will live for 100 years. So how many years you want to live, you decide and do one. Nikam Guruji. So you breathe out totally, then in that condition make movements of this you can do in the sitting position as well as in the standing position. So by doing, what happens, when you are making movements of the abdomen, the intestines they move.
But we have to make this movement faster as possible.
Yeah, as possible. So intestines will move. When intestines will move, the mesentery will also move. If the mesentery is moving, whatever fat deposited into the mesentery, it will get dissolved. So the pressure or the weight over the mesentery or the intestine will be reduced. Suppose you put lot of luggage on the horse, what happens? His speed reduces. If you reduce the luggage, he starts running. Similarly, if the fat weight is reduced on the intestine, the movement of the intestine will improve. If the movement of the intestine improves, the digestion will improve. You will not get any digestive problem. So this is the benefit of doing Agnisar. Now, since the fat got dissolved, now why you get tummy? Because these all 29 feet intestine, if they are fat laden, all the mesentery which I have shown you, if it is full of fat, it will require more place. Now when you are walking, when you are running, when you are doing more work, you want to breathe in more air. How you can breathe in more air? When this diaphragm can go down more and make more space available for air. But suppose here is house full, can this diaphragm go down? No. So you will feel breathless. That's why you find a person who has got lot of tummy, if you ask him to run, after few steps, I can't run. Why? Because he cannot breathe in more air. But if you do Agnisar, this fat will get dissolved, less space will be required for the intestine, diaphragm can go down more, you can breathe in more air and you will not feel breathless. So this benefit you get by doing Agnisar. Second, the movements of the intestine will improve, digestion will improve, you will not get digestive problem. Third thing, suppose you have taken your lunch, dinner, morning, if you don't go to toilet, you don't feel like going, then what you say? Today I am constipated, I have not cleared my bowel. But if you do Agnisar, what will happen? This waste product, which is the descending colon and sigmoid colon, it will be pushed ahead, so you will not get constipation, you will get relief from constipation. So this benefit you get by doing Agnisar. Then there is the pancreas. Here is the stomach, behind stomach is the pancreas, which secretes insulin. Insulin controls the blood sugar level. By doing Agnisar, pancreas is activated, insulin is secreted properly. If insulin is secreted properly, it will be sent into the blood. The level of the insulin will be proper, so blood sugar level will be proper, you will not get diabetes. Why you get diabetes? When there is a less production of insulin from pancreas, you get diabetes. That's why what we do, we supplement it with injection insulin. So this benefit you get by doing Agnisar. Now another thing, yeah, you can do it in sitting also. Padmasana. Now this is the Udiyan. You breathe out totally, stand like this and take your tummy inside. Maximum possible, you can hold it in this position. When you feel, now I cannot remain breathless, relax and you can breathe in. So this is called Udiyan. If you can do this Udiyan in such a nice way, all the intestines are compressed like anything, so there is less chance of getting any digestive problem. There is 5 liters of blood in our body. This blood has to come to the heart for purification every minute. How it comes? Along the impure blood vessel, it travels up, comes to the heart and get purified. Now suppose you are standing for a long time. After 4-5 hours, what you say? Oh, I am tired, I am getting cramps into the calf muscle. Why? Because when you stand for a long time, this blood, it has to come against gravity to the heart for purification. So if you stand for a long time, slowly the speed reduces, and instead of 5 liter, only 4 liter comes to the heart for purification. Rest of the 1 liter gets stuck over here. If 4 liters only purified, only 4 liters is supplied. If less blood supplied to the body, what will happen? You will feel tired. Now if you do Agnisar, you have taken your tummy inside, what will happen? There will be pressure over here. So this blood will be pushed up. There will be negative pressure over here. Because of the negative pressure, this compartment blood will be sucked up. When you do again like this, again this blood will go here, this blood will come here. This will act as a pump to lift the blood which is stagnated in the leg to the heart for purification. Now you might ask me, when you are taking your tummy inside, there is a pressure on this vena cava. Why blood will go up only? It can go down also, no? It cannot go down because these vessels, they have got one side opening walls. Now this wall, suppose this is the vena cava, this vein. So wall is like this. So it will open only in this direction. So blood only can go up. It cannot open this way. That is why with the pressure, this blood will come here. Next this blood will come here, and it will act as a pump to take the stagnated blood at the leg for purification to the heart. And that's why you feel fresh if you do Agnisar after this time. So these are the benefits of doing Agnisar and Udiyan. If you do every day, your tummy will be reduced, fat dissolution will be there. If there is less fat, you will not feel lethargic because maximum fat deposition is in the abdomen. Whatever fat deposition, it starts, it's first in the intestine mesentery, then into the anterior-abdominal wall, and then at other parts of the body. So if these fats get dissolved, you will not feel lethargic, you will be energetic. So this benefit you get by doing Agnisar every day. So these are the all benefits which are written in this. Your respiration will not be having any problem, pancreas will be activated, venous return will improve, you will not get any tiredness. So these are the benefits of doing. Now second, we are going to talk about the Shankha Prakshalan. Now why Shankha Prakshalan? You can get rid of habits. Sometimes somebody people, they have got bad habits of smoking, drinking. Some people, they have got urge to give up the habit, but they don't know the way. So if you want to get rid of the habit, try and do this Jaladhauti and Shankha Prakshalan. Because what is this? This is the acid. Sometimes you say, na, that fellow is very choosy, he want this, he want that, he want that. It is not he is demanding, it is his acid demands. So if you cut down the level of the acid in the stomach, your all habits will come down. And for this Shankha Prakshalan, last time we have discussed about Jaladhauti. So today I am going to discuss only on the Shankha Prakshalan. Now here what we do, we drink in the morning, you brush, then go to the toilet, then brush, then what you do, take 2 glasses of lukewarm water, big glasses, drink it, and then perform these 4 types of asanas. This is the first, then this is the second, then this is the third, and this is the fourth. If you do these 4 asanas, after drinking 2 big glasses of water, you will get rid of constipation. If you are having constipation, chronic long-standing constipation, try and do this. Because this is, you must have seen that trumpet they use for, it has got curved coils. If you put water from one side and you rotate it, it will come out from the other side, cleaning all these coils. Similarly, if you do 4 types of these asanas, see here, first you are done like this, the second you are done like this, third and fourth. So our intestines, they are 29 feet of intestine. So by taking 2 glasses big water and then doing these asanas, the water will flow ahead with pressure. It will clean all the 29 feet of intestine. If intestines are clean, their digestion will improve. Then acid level will go down. So your habit will come under control. And as this water passes ahead and ahead, when it comes down to the large intestine, it will press the waste matter which is stuck over here. So you will get relief from constipation. Usually, if you practice this, suppose somebody is having chronic constipation for years together. If you start doing this every day, in 3 weeks time, you will get relief from constipation. Now I am habituated of doing this. Moment I finish the 4th asana, I go to toilet. And I don't have to wait for that. So this is definite. In US, when I was taking class in New Jersey for the people, there was one person who was having constipation for years together. So he came to my class. I said, you do this. I was there for 3.5 months. He came around, I finished 1 month and then he joined my class. So he started doing it, and in 1 month's time he came and told me, now I don't have any problem of constipation. I am going to toilet early in the morning without any problem. But he is practicing this every day. He still writes me letter or sends me mail that I am okay, I am not having any constipation problem. So if you practice this, you can definitely get rid of this. This is called Laghu Shankha Prakshalan. This is only 4 asanas and 2 glasses of water. There is also Mahashankha Prakshalan, which you can practice once in a 2 months. That you should select on Sunday. You have to repeat it 3 times. Drink water, do these asanas, again drink water, again repeat these asanas, and after the 3rd set you will find that you will pass motion. Again you drink water, again do it. So whatever remaining debris are there, ultimately the 3rd or 4th set you will find only clear water is coming. Means whatever water you are taken in, only that is coming, because first set you will pass motion, so along with it some debris will come out. Second, some remaining part, and 3rd or 4th set you do, you will get only clean water which you have drunk in the starting point. And with this, that is why it is called Mahashankha Prakshalan. So it is done once in a 2 months or 3 months, when you can totally overoil or clean the bowels. That is about 29 feet. If you start counting from here, this is the esophagus is 10 inches, stomach is about 10 inches, duodenum 10 inches, then 23 feet small intestine, 6 feet long intestine. All these they get cleaned, and if all the intestines are cleaned, then next 1 month you can eat anything and again damage it.
So the difference between this and Mahashankha Prakshalan is only the drinking of water, both 3 times.
Here you are doing only for 1 time. The 4 asanas only once you are doing. You do this 4 asanas, again you drink 2 glass water, again do it, again you go to toilet, so it is washed out, again you drink 2 glasses of water, again you do it. So 3rd or 4th set you will only pass clear water which you have taken at the first time. Yeah, that means it has cleaned totally. Yeah. So this is Shankha Prakshalan and Agnisar and Udiyan. What? In 2 months or 3 months?
Timing.
Morning.
After 3 months.
First asana, how many minutes?
3 times.
Minutes.
Minutes. How many minutes you have to do it?
Each asana.
Now just I'll just show you. Suppose you are done like this. You have breathe in.
How many times you have to do it?
I am showing it. Na? See, this is the first asana is Bhujangasana. So then second is hold your hands up like this. Breathe in. Bend on this side. Hold it for some time till the time you can hold the breath. Then you come in. Then breathe out.
Do it, then breathe out.
Breathe in, then go to this side, hold the breath
Okay.
till the time you can hold it, then come in front and then breathe out. Then again breathe in, hold it,
Hold it.
come in front and breathe out.
Up to your breathing.
Breathing capacity. Then second, breathe in, come in front, breathe out. 180 degrees you should make it. Again, breathe out. These 4 asanas.
Only one.
No, 3 times. 3 times.
One
Three asana,
three times.
Yeah.
Because this time you
Yeah.
drink water.
Well,
Water 2 glasses in the morning, and then after each asanas 3 times. Yeah. So if you do this,
you are taking three
There is
breathing.
one warm water in it.
Three breathing.
yeah.
Throughout the day, if you drink warm water, you won't get any.
So by this you can get relief from constipation, you can get relief from your bad habits. Any questions, anyone?
When you say that, it's going to be
बंद करा